This episode of The Benefit Whisper is brought to you by Route 3 Insurance and Financial Services, where smarter benefits begin. If you're tired of rising healthcare costs and opaque insurance contracts, Route 3 is here to help you take control. They specialize in transparent, employer-driven benefit strategies that protect your people and your bottom line. Ready to break away from the status quo? Visit www.fixmybenefitsnow.com and discover how Route 3 can help you build a plan that actually works for your team and for your budget. Hello and welcome to the Benefit Whisper, the show where we pull back the curtain on what's really driving your healthcare costs and what you can do to stop feeding a system that's rigged against you. I'm Ralph Weber, and today we're crossing the border to explore what happens when you have universal coverage but limited access. We're talking about Canada, specifically the long and often dangerous delays in care for many Canadians, even when their coverage is technically free. Joining me today is Dr. Raymond Rupert, a Canadian physician, entrepreneur, and founder of RCM Health. Raymond's work goes beyond just diagnosis. He's helping Canadians with cutting through the red tape, with access, with second opinions, and getting critical care faster and smarter. Raymond, thank you very much for being here today. Before we dig in, can you tell the listeners just a little bit about your background and how you came to start RCM Health?
Sure. Thanks for the invitation.
Sure, thanks. Thanks for being here.
I was your plain vanilla family doctor until my little 18-month-old daughter got sepsis. And she was in the pediatric hospital, essentially dying, and no one knew what was happening. So I got all mobilized as a doctor, and I became her advocate. And I suggested to the very, elite team that they do an abdominal ultrasound, which they did, and they discovered she had a ruptured appendix. So it was just that little tweak, that little bit of jump right in, that advocacy, which saved her life. And now she's a very accomplished prosecutor. And criminals really don't like her because she's a pit bull. So things work.
That's great. Yeah. Wow. I'm so glad that you did what you did. And, I always I'm not sure if you listened to my first episode. I got into this because of a passion as well, because of some of the things that happened to me. So I always like it when somebody gets into what they're doing because of a passion rather than just, another job trying to make money. So that's great. I didn't know that about you.
Yeah. So it's been 30 years, so we're dealing with patients with unique and complex problems. When things are unique and complex, you need a project team, like you need an entire team. You need to coordinate care. You got to manage it like a project. And we've done over 30 years, thousands and thousands of very complex cases.
Wow, that's great. So let's start by talking about the waiting times. What's the current state of access to care in Canada from diagnosis to surgery? And I know it varies from disease to disease, but Can you talk a little bit about that?
Yeah, so the wait times are really a problem. And often we'll get called at RCM Health because somebody's on a wait list for a neurosurgeon for 2 years.
2 years?
Well, yeah. No, that's not uncommon. Say somebody's got spinal stenosis, they can really get into trouble because they can pinch the cord and they can get all kinds of complications.
Yeah.
And so our job is to then advocate for access to the public system. So we get all their data, we get their imaging. We can even have another neurosurgeon do a virtual case review. So now we have a second opinion. We have about 4,000 specialists in our network.
Great.
And the patient doesn't have to travel because we get all their data and their imaging, we package it up, and we have the neurosurgeon in Milan or Baltimore or wherever review it and provide an opinion.
Right.
Okay, so now we've got an opinion from a highly ranked neurosurgeon, which I give to the neurosurgeon who's got the wait list. And that sometimes changes the flavor because the neurosurgeon has 200 faxes on his or her desk, and it's very hard to triage them.
Sure.
But once we advocate and gain some visibility for the case, often they'll get expedited. Okay.
Wow. Yeah.
So that's kind of what you have to do in a public sector system.
Yeah. Raymond, to be honest, that's kind of needed everywhere, but mostly in Canada. Absolutely. I had to do that for my mother, as well. And if a patient doesn't have an advocate, they're just left on a waiting list to
Well,
get sicker.
they're on a waiting list or they fall between the cracks because
Yeah.
often people have multiple diseases.
Right.
And because the system is siloed, here's cardiology, here's rheumatology, here's orthopedic,
Right.
it's all
Yeah.
siloed. Unless someone is able to integrate the care, then people get into bigger trouble.
Right.
So
Right.
our job is to grab hold of it and unite or cause a collaborative effort to occur in terms of helping that patient.
Right.
Yeah.
That is a fantastic service. So what do Canadians misunderstand about the limitations of their system, and why don't Americans realize this?
Yeah. So most Canadians are living in a world of illusion bordering on delusion because they haven't had a serious illness. So,
Right.
here's a free system, has parts of it are excellent,
Right.
but they really haven't tested it. So once you have a serious illness, they soon discover that there's a lot of parts that are missing, and there just isn't enough capacity.
Yeah.
Okay, so the U.S. has tons of capacity. I'm totally respectful of the amount of capacity you guys have. We don't have that because if you only have capacity that's funded by a public system, you don't have enough capital. Okay, and so lack of capacity is one of the issues.
Right. So there are a lot of countries that have socialized medicine, but they have a two-tier system. UK,
Yeah.
Germany, et cetera. Canada is just different, though. How is it different?
That's a good point. So there are 3 countries in the world that only have public sector healthcare. Do you want me to give you the 3, Rob?
Absolutely. Yep.
Well, first of all, we have North Korea,
Right.
then we have Cuba, and then we have Canada.
Wow.
So
Wow.
little bit weird. So we kind of forgot that we should have a private sector option in the system.
Absolutely. And of course, in those countries, you actually can't pay a doctor for needed treatment or get private insurance. Is that right?
That is correct. You have to go through the public system, and there's no cash flowing anywhere, at least that is talked about.
Or leave the country.
Well, okay, yes, or leave the country. So what has happened is that we get someone that needs, say, a hernia repair, and they're in a queue for a year or 2 for hernia, and they're not having a good time. So we then develop a whole series of centers in the US or Europe where someone could get a hernia repair. So we had one fellow from Vancouver who was wintering in Scottsdale, and he had 2 hernias. And he was a pretty prominent guy. And even though he lived in Vancouver and was prominent, we couldn't get his hernias repaired up there. So he was in Scottsdale for the winter. We set him up. He got his hernias fixed, and he was a very happy fellow. So we're having to dip into the US or Europe for capacity, for access.
And hernia repair down here with what we do is often we will get a cash deal and repair. Regular umbilical hernia is usually under $5,000. The insurance cost sometimes can be as high as $27,000, but they're not. If you're paying cash, it's not a huge procedure cost-wise.
Right.
Are you often able to get reimbursement for that, or sometimes?
Yeah, so that's a very interesting question. So let's assume this fellow goes to Scottsdale, gets 2 hernias repaired, and it was charged whatever. So then if we submit that to the province, to the payor, you might get 3%.
3%
of the total. So if his total was X number of dollars,
Right.
he could probably count on getting 3% of X number of dollars. In other words, it's not really material.
Yeah. Wow.
No, it's kind of archaic. So, but anyways,
Yeah.
people want their hernias repaired, and off they go.
How long do people wait for things like, MRIs, specialty consults, and stuff like that?
Yeah, it depends where you live. If you live up north in a rural area, you could really be on a long lineup for an MRI. It might be 6 months or more. And then it depends on how urgent it is. But we actually have a workaround. So RCM Health works for companies. So say somebody works up north for a logging company, where they have the forest fires that are creating problems in the States. So the fellow who works at the logging company, if the logging company buys the MRI, I can get it done in 2 days.
Oh, okay. Okay.
So
the
there is
company pays, not the patient.
You got it. Yeah. So a company can pay as a so-called third-party payor.
Right.
So the logging company doesn't want the guy to go on disability.
Sure, of course.
So they hire us. We organize a private MRI, get that done, have a
Mhm.
neurosurgeon in Baltimore, Milan, or somebody look at it quickly. Then if he needs fixing, then we advocate for public sector access.
So now there's a program in Canada which unfortunately I am familiar with, and it's called the MAID program, MAID. How does it work? Who participates? What are the outcomes? What does it do?
Yeah, so MAID stands for medically assisted death. Pretty contentious when it came into being. It's a reasonably well monitored and managed program because you need two physicians to be
Right.
on the decision making committee, etc.
Mhm.
And the person needs to have capacity. Okay.
Capacity.
So, for example, today we got a message from a client patient and the family that mother who's got metastatic pancreatic cancer, she developed abdominal sepsis, she had a ruptured gallbladder, like she's really miserable.
Mhm.
So mother decided to have MAID because she may never recover from the sepsis.
Right.
So what'll happen is that the family or the hospital will bring in two doctors on a kind of advisory basis to determine if mother meets the requirements. And if she does, then within 2 weeks, she could have a MAID procedure, which is essentially intravenous medications, and you simply go to sleep forever. Yeah. So there are appropriate, but one of the most contentious areas is really a mental health patient who has a tremendous amount of suffering, and they're able to actually convince the committee that they should have MAID.
Wow. Wow.
And so,
So
yeah, go ahead.
sorry.
Yeah.
Yeah. No. So it's a way of getting rid of the old people that are costing the system money. It,
You can't
it,
say that, Ralph, or they'll have
oh.
me leave Canada. So
Oh. Okay.
no, it's not, it's not a cost reduction strategy, but it's supposed to be, a rational, humane approach to excessive
Mhm.
suffering. Now, the one case we have now where the woman has a mental health issue or chronic pain, she's actually treatable. So the son hired us before she goes off and does MAID to help organize, say, deep brain stimulation
Mhm.
for chronic pain, which can help.
Right.
And hopefully we're able to help her with GBS and she
Mhm.
won't have to call for the MAID police.
Wow. So you founded RCM Health to fill in a lot of gaps, which obviously exist. What exactly do you do for your clients? And you've talked
Uh,
about some of it already, but just to kind of
so
sum it up.
yeah, so they usually have a unique or complex problem. And most of them want a second opinion. So today, my team, I have about 30 employees. Today, we organized a virtual assessment for a 70-year-old patient with a very aggressive brain tumor called a glioblastoma.
Mhm.
Okay. The glioblastoma is, in her case, is really can't be treated with chemotherapy because it's methylated. So she had surgery in May to resect or remove the brain tumor. And then she started on chemo and radiation. So the family wanted a second opinion. And the kids, who are very well equipped lawyers, found a neurosurgeon in Montreal who does a lot of what are called redos. He
Right.
redoes the surgeries. Okay.
Okay.
So we had a nice little virtual session on Teams, and we had equipped the neurosurgeon with imaging. So he put the imaging up on the screen and showed the family that the first surgeon had done nothing. Nothing. The
Wow.
first surgeon had opened and done a
Mhm.
wedge resection, essentially an open biopsy. And the family thought that the tumor had been resected.
Mhm.
Well, it hadn't. The
Wow.
second surgeon in Montreal,
Mhm.
who's just brilliant, said that he could totally resect the tumor. So currently, her expected lifespan is 6 months to 9 months,
Mhm.
and now it's going up to 4+ years.
From
Okay,
half a year, so eightfold at least.
correct. Yeah,
Wow.
because we dug in.
Yeah.
We got as
Yeah.
deep as we could go. We got the right provider. The province is going to pay. We're getting a private MRI done in 2 days.
Mhm.
We're going to make sure the tumor hasn't extended anywhere else. And then she'll go to Montreal and have her glioblastoma re-resected.
Mhm. Wow. That is great work, Raymond. That is just incredible. And down here also, we advocate for our patients. We
Yeah.
have cases where medications are not authorized where we get them. One case that we're working on right now, a patient needed a medication that's very, very expensive, 20 grand per treatment, 18 treatments per year. And I think
Oh,
we have a good chance of getting it completely for free. That's what
well,
we're
that's
working
good
on
for
right
you.
now.
Well done, Ralph.
Yeah,
Well
thank
done.
you. Yeah.
Good.
So now, second opinions, are very, very important. Are there any times that somebody other than the one you just spoke about actually helps in avoiding unnecessary procedures or delayed treatment, or even a misdiagnosis?
That happens quite often. The doctor may have been too aggressive or not aggressive enough. And so having a second or third opinion can be very important to avoid mistakes or misjudgments or whatever. And we do lots of second opinions. And the patients can be anywhere when we do our
Mhm.
second opinions.
Oh, okay. So they don't
Yeah.
have to come and visit you in person.
No, it's all done. We get their data. We're moving their
Mhm.
data around. So we get their data, their imaging, we summarize things, we select the provider wherever they are.
Mhm.
And then we have a virtual session to review things like we did today with the lady with the brain tumor.
So some American employers that are paying a ton of money for healthcare, the average cost right now is $16,000 per year per person, up to as much as $38,000 for a family. It's very, very expensive. So some employers might think that a free system sounds really appealing. Based on what you've seen, what would you warn them about?
So if they had their manufacturing plant in Canada, et
Hmm.
cetera,
Yep.
yeah, well, there's long delays for everything. So people are
Hmm.
going to go on STD or LTD
Hmm.
waiting for the neurosurgeon or whatever. So, but those costs are really incredibly high. So I'm quite shocked, Ralph, that the costs are really that high to insure a family. Wow.
Well, they don't have to be. Those are the Milliman average indexes. Most of our clients are paying considerably less than that,
Well, that's
considerably
good.
less.
It's good
Yeah.
for you. That's
Yeah,
great.
absolutely. Thank you. So, what's your take on how sort of concierge level, which obviously is what you do, navigation or case management, it can improve outcomes? Even for example, in US employer sponsored plans.
Yeah, I mean, if you've got early intervention happening and you can pick something up early, then you're going to help everyone. So we've got a new treatment now for totally occluded coronary arteries, which is unbelievable. So we had a patient who was a surgeon who had a totally occluded left anterior descending artery, which is called the widowmaker.
Right.
And the doctors could not get a stent in because the opening to the LAD was closed and the pipe was totally calcified. He's an
I see.
older dude.
Right.
So older dudes get calcified pipes. So what did we do? We found a interventional cardiologist who could drill it out.
Drill it out. Black and
You,
Decker?
yes,
No. Really?
it's the world's
Wow.
smallest drill.
Wow.
So they feed this drill bit up
Right.
through your artery, into the opening of the artery.
Hmm.
And in an older dude, it's like a calcified pipe.
Hmm.
So you just point this Black and Decker little tiny
Hmm.
drill at the
Right.
artery, and you can
Hmm.
drill it out.
Wow.
It's called a rotatory atherectomy. So we're looking for patients with occluded coronaries who want to get drilled out.
Wow. That's
Just not,
great. I have never even heard of that.
oh, we love to see what's sort of bright and new and
Yeah.
sparkly,
Yeah.
pretty exciting, eh?
Absolutely. And of
Yeah.
course, a lot of things that are bright and new are not necessarily available in Canada. Isn't that right?
It's not available in Canada. So then we
Hmm.
look to the States.
Uh-huh.
And yeah, it's pretty expensive in the US at about 20 to
Hmm.
40 per drill bit.
Hmm.
But we can actually get it done in Turkey for 2000 US.
Wow.
Yeah,
$2,000
US.
US dollars. That's great.
Yeah. Well, and they have a lot of experience with rotatory atherectomy. So, yeah. So we're kind of building a global network so we can save people some money.
Absolutely. What are the psychological effects on patients that when they feel they're stuck in a system, whether they're Canadian or American, any kind of a thing that delays care?
Yeah. Well, they're traumatized.
Right.
They really are. Because if you're feeling trapped, helpless, you have no control, and you're just a victim of the situation, then you're really unhappy and suffering.
Yeah.
And people want and need help with their complex disorders. So, we like helping
Absolutely.
people at RCM Health. It's our job to make sure that they get the best possible outcome.
Right. Right.
Yeah.
And the patient that I was talking about earlier that needs this drug, ultimately we want to get the insurance company to pay. But again, we're pursuing several avenues at the same time just to get him some care that he
Yeah.
needs.
No. That's very important.
Yeah, absolutely.
Good.
So, open floor. Is there anything you're seeing in the healthcare space right now that more people should be talking about?
Well, I think prevention is becoming ever more important now that we've got AI. So, we can get a lot of data points on people. The more data points, the better.
Right.
Put it into the AI engine and it can build preventive programming. So we've got a program called the Healing Journey, and it's for people that have been traumatized. They've had breast cancer and gotten over it and want to be re-energized and renewed.
Right.
So we have our program called the Healing Journey, for someone who's burnt out or someone who simply has some risk factors and like to reduce their risk factor and prevent the stroke from happening.
Mhm.
I think there is considerable interest in wellness and longevity and health span. I think
Sure.
that's an important trend.
Yeah. So in Canada, can you, and I remember talking to Dr. Brian Day about this years ago, was the executive director, president of the Canadian Medical
Yeah, he was
Association.
the president of the Canadian Medical Association. Yeah.
Right. So, and we could have a whole episode on him with what he's doing in Vancouver. But one of the things that he told me, and I want you to comment on this, is that preventive care is almost impossible to get. You can't just go in and say, I want an annual physical or I'd like a colonoscopy. Is that still true?
Well, the government restricts access to things like colonoscopies or pap smears for women because they get cut
Mhm.
off at a stage. So no, but you've got to develop your own essentially prevention program, and there are some doctors that are more geared towards prevention. So the individual has to find the right doctor and then adopt a wellness program on a
I see.
consistent basis. Yeah,
Right, right. But you can't just go to a GI surgeon and say, I'd like a colonoscopy.
that is correct. That is a
Okay.
no-no.
You just mentioned AI, but any innovations in diagnostics, navigation, or virtual care that you think hold real promise, both in Canada and the US systems?
Yeah, I mean, everyone wants to be screened for cancer. So you have this new test called Galleri. Do you know about Galleri, Ralph?
No, I don't. Sorry.
Yeah, so Galleri is brilliant. So it's a blood test and it can screen for 50 types of cancer through a blood test.
Wow.
Yeah, and all the cancers have a different signature in that
Hmm.
methylation signature. And so they do the blood test and then they can
Hmm.
screen for 50 different things. And so that's a pretty useful test that could be included in an annual physical or whatever if people
Right.
knew about Galleri.
Right. So is that available in Canada?
Well, I was chasing it. It's been in the States now for 2 or 3 years. I kept
Hmm.
hammering Larry, saying,
Hmm.
give it to me, folks. Well, eventually it got approved in Canada, so we can do
Oh,
that.
okay.
Yeah.
Okay.
And that is not covered by the health system.
I see. I see.
So
And
it's an
mhm.
option for patients.
Okay. And
Yeah.
we talked earlier about, paying cash, things that aren't covered, like a chiropractor, for example, that aren't covered by the health system or prescription drugs. Those you can pay for, right?
Yeah, that's right. Exactly.
Right.
They're outside
Yep.
of the federal system or the Galleri test, which is not part of the medically necessary set of lab
Right.
tests. Yeah.
Right. So when I lived in Canada, because, as you know, I'm Canadian, left Canada 20 years ago, because of the healthcare system, largely, I was an air traffic controller and commercial pilot. So I was allowed to go in for an occupational physical, every
Yeah.
year.
Yeah.
Now, of course, they didn't do blood work. They did, some EKGs and stuff. I had my blood work done by applying for life insurance every once in a while, because then they do a lipid panel. So that's what I used as my work.
Sure. Yeah. Well, people can, there are preventive health doctors who are outside of
Mhm.
the system. So
Ah,
they can be, because the system doesn't pay for screening or surveying.
right.
So you can go to doctors that just do preventive work, and that's private
Mhm.
pay.
I see. Gotcha. Well, Raymond, this has been very eye-opening for our listeners, I'm sure. Thank you for helping us look behind the curtain of Canadians' healthcare system and sharing how proactive navigation advocacy literally can be a lifesaver. Before we wrap up, if somebody wants to learn more about your work or refer a client or become a client themselves of RCM Health, where should they start?
Thanks for the invitation, Ralph, to come and chat. And I really enjoyed this opportunity. If people want to reach out to RCM Health, we have a website, which is rcmhealth.ca, www.rcmhealth.ca. And we're really nice folks, and we like helping folks. So happy to respond to anyone's queries.
Excellent. That's really good. Thank you for what you are doing, what you've done. And to everybody listening, just because a healthcare system is public and free, it doesn't mean it's accessible. And just because your plan is expensive doesn't mean it's effective. Real healthcare reform starts with transparency, accountability, and competition, and the courage to challenge the broken system. I'm Ralph Weber, the Benefit Whisperer, and if this episode helped you to see things differently, please share it, like it, share it with a friend, somebody who needs to hear it, subscribe, and if you subscribe, you will get each new episode as it's published. And of course, you can reach out anytime by email, ralph@thebenefitwhisperer.com. Call us at 832-924-3330 or visit www.fixmybenefitsnow.com. Thank you again, Raymond, for being here today. Very, very enlightening. So let's just keep raising the bar because no one else is going to do it for us.
Thank you, Ralph. Appreciate it.